Well, good evening. Thank you so much for joining our telephone town hall meeting to provide you with the national and local response to the coronavirus outbreak. I'm Kurt, and I'll be the host of this evening. I'm going to be joined by Congresswoman Karen Bass in just a couple of minutes. We want more neighbors to get on the line and all that kind of stuff. Sorry about that. Who has assembled experts and elected leaders for this evening's call to discuss resources available to you and your neighbors in the midst of this outbreak. In just a couple of minutes, I'm going to kick this off, but I'm going to say this again, and I'm also going to remind you, we're going to be reading questions over the air tonight. If you want a question read, please press 00 over the keypad on your phone. Karen Bass will be reading these questions and getting answers to them. So if you want to press 0 and get your question in, this is the time to do it. 0 on the keypad on your phone. Again, good evening, and thank you so much for joining our telephone town hall meeting to provide you with the national and local response to the coronavirus outbreak. I'm Kurt. I'll be the host tonight. I'm going to be joined by Karen Bass in just a minute. We have a bunch of experts on and elected leaders for this evening's call to discuss resources available for you and your neighbors in the midst of this outbreak. And again, these calls work really, really well if you press 0 to get your question in, and Karen will read those questions over the air and get them answered. After we introduce everybody, Karen Bass, take it away, please.
Thank you very much. To everybody that is on the line, I just hope you are doing well. I hope your friends and family are okay. This has spread in such a dramatic fashion that I think most of us now know people who have gotten COVID, or we even know people who've passed away. And I certainly hope that there's no one on this line that is that way. But I just hope that we're doing everything that we can to keep ourselves safe. We've been through many crises in our country, but I know we have never been through anything like this at all. It's always so profound to me to think that just 3 weeks ago we had 8,000 cases in the United States, and now we're close to 350,000. So we are fortunate in our city and in our state, of course, that we have the leadership that jumped on this right away. But all of us can see now what happens when you don't have strong leadership at the top. The cities and the states are having to step up. So, we do town halls all the time, but this one is going to be a little different because people need concrete information. And so that we passed this massive stimulus bill a little over a week ago, and in that bill, several areas of resources are provided to people, the checks of $1,200, the extension of unemployment insurance, the small business loans, the deferral of student loans, resources to community health centers. And so it's fine to pass legislation, but now the real deal is what happens now. And so to do this call, we're going to have a variety of people on. We're first going to be joined by our Councilman Marquise Harris-Dawson, who's been doing an outstanding job fighting to make sure that we have the city resources. We're going to have John Alvarez, who's the director of the South LA WorkSource Center, who's going to talk to us about unemployment and sick leave and family leave benefits. We're going to have Claudia Monterosa with the LA Housing and Community Investment Department. She's going to talk about the eviction moratorium, the city eviction moratorium, and other housing protections. We're going to have Nurea Samimi from the California VITA program coordinator. She's going to talk about help with filing your taxes. And VITA stands for Volunteer Income Tax Assistance. We're going to have Leila Fiedler, technical advisory from the tax board, to talk about the earned income tax credit. And Louise McCarthy, who has always been there when we needed her, executive director of the Community Clinic Association, talking about access to health care, testing, and staying safe. So that's how we're going to do the call. And then the other thing that we're going to do is when you ask questions, I'm going to read those questions as opposed to getting people online so that we can get through as many questions as possible in this hour. So without further delay, let me welcome the City Council member for the 8th District, Councilman Marquise Harris-Dawson.
Well, thank you so much, Congresswoman Bass, and good afternoon to you and everybody who's on this call. I want to thank you for connecting with us and having us be a part of this discussion. It's such a critical time There's such a need for information. There's such a need for all of us to be talking to each other. And so this is one of the best vehicles to do that. And so we thank you for that. Also want to thank, I know a few folks who work for or contract with the City of LA have joined us on the call to provide in-depth details. The role of the City of LA, and I think every city in LA County, certainly in the congressional district, is about threefold. One is we have a responsibility to regulate and make sure utilities happen. And so one of the first things that we did once the mayor of LA called an emergency, made an emergency declaration. Very important, City of LA made an emergency declaration almost immediately, which allowed the mayor and the council to do some things that might not be allowed under normal circumstance. One is no electricity or water shutoffs during the emergency, regardless of your ability to pay. If after March 1st you got a disconnection of either of those services, they'll be reinstated. If you're in the City of LA, reduced parking enforcement for folks who are going to be staying home, street sweeping days, other days that you may not be able to park in a residential area. We reduced that as well. But the big things, the two big things are protection for housing and house the residents of Los Angeles, and then protection for workers and small businesses. And so we've been trying to work very, very closely with our members of Congress here in Southern California to make sure our businesses access the services that the benefits that are coming from the federal stimulus bill, but also make sure that we have an eviction prevention for at least 3 months, and to make sure that they don't have shutoffs of utility, and that those that can do some business do that. The other is housing. We want to make sure folks, an already insecure housing environment that we have in LA and Southern California wasn't set aflame by this emergency. And so we passed an eviction protection, which basically puts a moratorium on evictions for the next few months and gives folks 12 months to pay back any back rent that they accrued during that time. So those are the two big categories, but I want to let our representative, the Director of Public Policy and Research for the Executive Management Division of our Housing and Community Investment Department of the City of LA, Claudia Monterosa, who's been so gracious to come on the call with us today. Want to kick to her. She's been a champion and an expert on housing policy, but really trying to create a playing field where everyday people have a fair shot at good housing. And she's been the one managing sort of everything that the council and the mayor has thrown against the wall to make sure as many people as possible stay in their homes during this incredible emergency. And so with that, I will flip to Claudia.
Good afternoon or good evening. Thank you so much for those words, Council Member. Again, my name is Claudia Monterosa, and I do work on public policy research. And most certainly, my preoccupation and main interest has been understanding the impacts of the COVID-19 on our most vulnerable tenants. And so we have a limited time, so I want to go into the protections that are being afforded to tenants in the city of Los Angeles. And I do want to emphasize that we are going to be focusing on the eviction moratorium, which was enacted by the council unanimously on March 27th and made effective the following day by the mayor through an expanded executive order, emergency order on the 31st. First and foremost, there might be a lot of confusion about what is what. There are several levels of government that are enacting different eviction moratoriums. The one that applies for the city of Los Angeles is the order that was enacted on March 30th, and that one includes two additional items. A rent increase freeze, all units subject to the rent stabilization ordinance. Those are units that were built before 1979. It also puts a halt on any LS Act provided evictions up to 60 days after the emergency order gets lifted. And the expanded eviction moratorium states that no owner can evict a residential tenant for non-payment of rent if the tenant is unable to pay rent due to any COVID-related items such as loss of a job, closures, reduced hours, increased child care expenditures due to school closures, any related health care expenditures stemming from the COVID-19, and any other reasonable expenditures stemming from the government-ordered emergency orders. I do want to emphasize that the tenants are still obligated to pay a lawfully charged rent. However, the expanded order does include 12 months following the expiration of the local emergency to repay back the rent that is due. A new provision that was added in that order is that HCLA is going to play, and this is the housing department for the city of Los Angeles, not the housing authority, but the Housing and Community Investment Department, will have a role in agreeing to a mutually repayment plan for the unpaid rent. This is something that the department is currently working on at this point, and further guidance is forthcoming. In addition to that, an owner cannot evict. No property owner shall exercise a no-fault eviction. So if there is construction going on, you cannot be evicted or issued a notice to be removed from the premises. And you also cannot be evicted due to the presence of unauthorized occupants or pets or any nuisance related to COVID-19. And a landlord cannot charge any interest or any late fees on any unpaid rent. And landlords, more specifically, are now required to give a written notice to all tenants that these protections are afforded to them before the end of March 31st, which is already happening. So HCLA is working very expeditiously right now to provide as much information as possible. We actually are recommending that if you have any questions or you need to file a complaint, to please visit our website at www.hcla.lacity.org/file a complaint, or call our hotline at 866-557-7368. If you do get an eviction notice, you must call the department immediately because you will have protections afforded to you under the City of Los Angeles. Another huge question that tenants may have is if there will be rental assistance available for renters who cannot pay their rent. The department and the city council and the mayor's office are currently working on an emergency rental assistance program, and that is forthcoming and will be heard at a future council meeting. So we are working on that program to be able to provide some rent relief to tenants. So if there are any questions in terms of the differences between what the governor issued or what the county has versus the City of LA, I would urge the tenants to really refer to the City of Los Angeles Housing and Community Investment Department website. That information is being consistently updated on a daily basis. And to end here, I would like to ensure that tenants make sure to communicate with your landlord about your inability to pay if your income is affected immediately. Do not ignore any notices issued by the landlord or the property manager. If you file a complaint with ACE, be sure to comply with the requirements and documentation. If you're able to provide any documentation, that will provide you with a lot of assistance in the future. And all tenants are responsible, as of right now, to pay back that rent, although we are going to be working to figure out what that looks like in the near future, because this is a moving issue, and people are not going to be able to have the necessary income given the furloughs and layoffs that people are currently facing.
Thank you.
I have more information, but I will just defer back to Karen Basson. Thank you so much for having us here this evening.
Thank you very much, and I do hope that you'll be able to stay on the line. We're going to take all of the speakers, and then we will open it up for questions. Our next speaker is John Alvarez, the director of the South LA WorkSource Center. He is going to be talking about how to get access to unemployment, family leave, and sick leave benefits, as well as how to get computer access through the WorkSource Center. Mr. Alvarez, thank you for joining us.
Thank you very much. Hello, everybody. Hi, my name is John Alvarez. I'm with the South LA WorkSource Center. We're located at 1512 Slauson Avenue, between Normandy and Western. Our phone number is 562-445-3673. I will repeat it when I'm complete my talking. What we're doing presently, we're a WIOA program, okay? There are 16 other WorkSource centers through the city of Los Angeles that can assist people. I do recommend people, if they're needing assistance finding access to a computer or filing for unemployment, please Google your WorkSource centers and see which one is closest to you. At the WorkSource Center on South LA, what we've been doing lately for the last 3 weeks is assisting people that don't have access to computers. We've been doing it by appointment only. We have been practicing social distance. So if someone needs to apply for unemployment and does not have access to a computer, they're more than welcome to call and make an appointment. If they do have access to a computer, they could go online. I've been having people Google UI online, okay, and then they would just go on and follow the steps, okay. They could also go through the EDD website, which is edd.ca.gov, okay. People have been making phone calls to us, and we've been able to walk them through some of the questions, okay. They're also to file their claim by phone, okay, but most of the time people are not able to get through on the high volume of calls. Okay, the number for that is 1-800-300-5616. That goes to EDD, and they only take calls from 8 to 12. Over the last 2 weeks, I have not heard of one person getting through. So we have been recommending doing it online. Okay, you could also do the family sick leave online. They're done by that. So what we recommend is that, you go online and you file your claim. You will receive something in the mail 10 days later, okay? We do recommend that when you open up your claim, please write down your passwords. We've been having people come back that forget their passwords. Write down your passwords. It makes things so much easier. So we are a WIOA program, Workforce Innovation Opportunities program. We are going to be having special funding made available for people affected by the COVID-19. Okay, so if you go to your local WorkSource Center, let them know that you've been affected and that you are collecting unemployment. They would like to enroll you into their program. Our funding hasn't become available yet, but it should be coming up within the next 2 weeks. They're going to be doing it they're calling it supportive services. Okay, they haven't broken down to us exactly what they're going to pay for, but there are going to be resources available. So if you do have questions, please give us a call. We could walk you through a lot of it over the phone. But if you do need help, just give us a call at 562 area code 445-3673. Number again, 562 area code 445-3672. Or you could apply for unemployment by Googling UI online. Okay. After what we would like if people give us a call, once we are able to bring people in without appointments, we will be having orientations to assist people in finding employment. So thank you very much, and everybody be safe.
Thank you so much. Appreciate it. And like I mentioned before, I do hope that you'll be able to stay with us till we get to questions. As I mentioned at the top of the call, when we pass the bill, one will get a check for $1,200. That is, if you make under $90,000, you will get a portion of $1,200. If you make under $75,000, you will get $1,200 and $500 for each child. Assuming that you receive Social Security payments or you file taxes for 2018 or 2019, you don't need to do anything. Of course, you know the IRS knows how to find you, so they will either make a direct deposit to your bank or they will mail you a check if they do not have your banking information. If you've not needed to or didn't file your taxes for 2018 or 2019, there is help to get that done so that you can qualify for the $1,200 payment. Our next two speakers are from the California Franchise Tax Board, and they will talk briefly about the free tax filing assistance program and about other cash benefits that are available to people, low income and moderate income, through the state and federal government. The federal government is the Earned Income Tax Credit Program. So the first person, Nuria Samimi, will talk about the Volunteer Income Tax Assistance Program. Ms. Samimi.
Thank you, Congresswoman Beth. Hello, everyone. It is my pleasure to share some information with you all tonight about VITA, that stands for Volunteer Income Tax Assistance. So VITA program offers free tax filing assistance to people with low to moderate income, generally people making less than $69,000. Also to persons with disabilities, and also to limited English-speaking taxpayers. So there are a couple options for you to get your taxes filed for free. One is to contact a VITA site, and there are VITA sites throughout the state, and all you need to do is to locate one near you. So to do that, you can actually do that by going to Franchise Tax Board website at stb.ca.gov or on IRS website at irs.gov. From either site, you can access the VITA site locator link, and you can simply put your zip code, and you would get a list of all the sites, VITA sites close to you. Unfortunately, due to the current pandemic, some of these sites may currently be closed or have modified operations, such as over-the-phone assistance. So it's important that you may have to call first to inquire more information. So if a VITA site near you is closed, the other option that you can have to get your taxes done for free is to use a free software. You can do that by using the free file online lookup tool on IRS site to file your federal return for free. And then once you do that, you can actually use the CalFile option on FTB website to file your estate returns for free. So now I will turn it to Lila, who will tell you about some credits that you also may qualify by filing your taxes. And then we can take, any questions that you have toward the end of the question and answer time. So thank you.
Thank you. Yes, both the federal government and the state of California has what is called an earned income tax credit. California initiated this credit back in 2015, and basically if you're a low-income individual, even if you have no children at all in the state of California, as long as you're over the age of 18, California does have an earned income tax credit as long as your income is lower than $30,000 or $30,000 or lower. It can at less than $30,000 in income, a single individual over the age of 18 can qualify for up to $240 of California earned income tax credit. In addition, you can also apply for the federal earned income tax credit. A single individual with less than $21,370 would actually qualify for up to $529 of federal credit. These credits do go up depending upon your income and the number of children that you have. They do cap out at 3 children or more. An individual with 3 children or more in California with $30,000 or less in income, they can actually get a maximum credit from California of $2,980. For the federal government, if you've got 3 children or more and you have less than $50,162, you can get up to $9,539 in credit. So there's a significant amount of money that's out there. A lot of people haven't been taking advantage of this credit that's available. And in fact, if you haven't filed in the past, you can file for those returns. For California, this started in 2015. Now, the rules have changed over the years, so it will vary, but you can still file for 15, 16, 17, 18, and 19. Now, for California purposes, we've extended the due date for the tax returns, moving it from April 15th to July 15th. So anything that's filed, including even the claims for refunds or past due returns, can still be filed for 15 until July 15th. And at that point, if there's any questions, I'll take questions on that.
Thank you very much. Thank both of you. Our final speaker before we open it up for questions is Louise McCarthy, the Executive Director of the Community Clinic Association of LA County. And obviously, because we are dealing with the public health crisis, we wanted to have someone on who could speak to that. And I just want to thank Louise in advance. She's always available to jump on these calls when we have needed her to be. And Louise, before you begin, let me throw a couple of questions out to you that people have asked. They want to know about testing. They want to know where they can get tested, and if they got tested, could they tell if they were immune? Will the test determine if they're immune? They want to know about protection for healthcare workers, and they also want to know what about the places that have not observed the protocols? What about those states, and what impact is that going to have on people in California? Take it away, Louise.
Okay, thank you very much, Congresswoman. And thanks again for representing me personally, as well as all of the folks here on the phone dialing in for the town hall. I'm really glad that you're there for us. So as mentioned from the Congresswoman, I run the Community Clinic Association of LA County. We're all of the nonprofit community clinics and community health centers all across the county, from Antelope Valley down to Long Beach, Venice to San Gabriel. But here in this district, you see a number of our members all over the district serving people based on the communities in which they sit and making sure that they're culturally competent to serve them. I'm going to answer those questions a little bit as I go through this, and then some of those final questions I've got thinking about on that a little bit. But what I want to do is put this in two categories. One is the public health lens, and then the other is the personal health lens. So on the public health lens, I think it's really disheartening every time, or alarming every time we open up the news and hear the numbers are increasing, whether that's in LA and California or nationally. But just because you see numbers increasing does not mean there are more new infections. That means that we are detecting infections that exist right now. So as more tests become available, I hope folks have questions about tests, and there have been very limited testing to date. Testing has increased over time, and because of that, the numbers detected have increased. So don't be dismayed by the increases in numbers. It shows that we are doing better at detection, as long as we're doing well on all of the other things we need to do to bend the curve, namely shelter in place. I know we're all feeling a little bit cooped up. I want to say that amongst our circle here, we don't refer to it as social distancing. We call it physical distancing, because we want to kill this virus, but we don't want to kill our community or our friendships or our families. right? So it's very important that as people get isolated and are in their own homes, that we think of them, that we're reaching out to them, that we're continuing to find ways to make those connections. So even if you can't be physically together, you can find other ways to virtually reach out and keep that sense of community, which is really, really important. Hygiene, washing hands, saying happy birthday 2 times. There's a couple other catchy songs and a little bit more popular that you could sing as well. But anytime you leave your home, and I go to the store on Slauson and I see the folks with the masks and everything, and that's great. But think about, as you're walking through the world, everything you touch that is not in your control. A door handle, someone's dog, whatever. If something's not in your control, after you touch that, wash your hands. And absolutely don't touch your face, your eyes, your nose, your mouth, unless you've washed your hands first. Next, tests. Like I said, they're currently limited, and priority has been going to those most likely ill and those most likely at risk. So what we do is first there's screening, and then there's testing. So anyone that thinks that they could potentially have it or be exposed to it or be at risk, the first thing you do is call. You don't drive to the emergency room. You don't pull up to a clinic. You call. And what they'll do, the clinics that I represent, for example, they will screen you over the phone, ask you questions to determine whether or not you are in the priority population to be tested right now. And if you are, then they will refer you to the place to get the test done. It might be a public health lab. It might be a Quest lab or LabCorp or even one of the clinics. A number of clinics are doing testing on site, but they're testing people after they screen. So just because you don't get tested, it's okay. We just want to make sure that the most vulnerable are getting the tests first, and so that we can isolate and take care of them, especially if they have high risk with their health and underlying health conditions. More tests are coming. Different types of testing are coming, and so keep an eye out for that. I have not heard, relative to that question, about immunity. The tests that we've been using and are working with are just, do you have it, do you not? And it doesn't determine any kind of immunity. We are learning that if you get over this, you are less likely to get it again. And so that is, if you get it and you get over it, getting exposed to it again, you're less likely to contract it because you've got the antibodies built up in your system. Now, on personal health, first, like I said, call your health care providers first before you go to them to determine whether or not you should go in, whether it's for a test or for routine or urgent medical needs. There are a number of things, thanks to our governor, that we are now able to do under this emergency order. So we can now provide phone visits, and we can order refills for medications over the phone. So a lot of the stuff that you used to have to wait in traffic to get to your doctor for, you don't have to anymore. So those are options that are available. But it's always about call. And if you don't have a provider that you go to regularly, you can go to 211la.org, 211la.org. Type in what you're looking for and your zip code, and they'll give you the resources. It's a very, very helpful resource. Keep those personal health appointments that are urgent or important in order for you to stay healthy. We don't want to get out from this crisis only to have another crisis of deferred care. If people have been avoiding dealing with their diabetes, their hypertension, if they haven't been getting the appropriate checkups during their pregnancy, all of these things could create other public health problems down the line. So call first. Maybe they can help you over the phone. And I do want to say one of the things that's really interesting, necessity is the mother of invention. And so because of this crisis and moving to phone visits, we are finding that many, many more people are reaching out for mental health services and counseling by phone. And that's just, it is important for folks, especially in a time like this where people are isolated, they're stressed out or uncertain about so many things, including all the topics of the speakers before me, to get access to a counselor. Call your primary care provider, and they should be able to get you a referral. We have parity in mental health thanks to the Affordable Care Act. So it's just, I really want to flag that. And then relative to the questions, protection for healthcare workers. This has been a real challenge for us. Getting masks out, N95, surgical masks, gowns, all of these different things to the community clinic workers, because we want to make sure that they're safe as they're seeing patients. Also, the hospital workers all need to have those resources. What's happened, thanks to the declaration of emergency at the federal level, and there's a lot of chisme and beef about whether or not how fast these resources will come down, but there is a federal stockpile, and it's starting to make its way to Los Angeles. And the county public health emergency services is in charge of distributing that through existing channels. And so they're doing that and prioritizing the folks that are in the hospitals, the folks that are in the isolation units for our homeless neighbors, and the folks that are in the community clinics and community health centers, because we want to make sure that they are safe. And I just want to appreciate so much all of the healthcare workers and caregivers that are doing good work at this time, because they're really on the front line, and just know that the anxiety we feel in their shoes, it must be just tenfold. And then finally, this question about states that haven't observed the emergency, states that are saying, yeah, keep going to church, keep doing that. All we can control is ourselves. And unfortunately for those states, they're going to have some ugly lessons to learn. But I'm hoping that the limitation on travel will keep the issues happening in those states from coming to ours. So it's unfortunate that people aren't all taking the same precautions everywhere, but the only folks we can control are ourselves. And I will say that even within our own communities, we've seen people here in South LA having a birthday party, and the police broke it up because they said, you're not supposed to do this. So we can police ourselves, we can police our neighbors. These other states, we're just going to have to do the best we can to stay clear of them until they figure it out. It's an unfortunate situation. But those are my main key comments, and I think it's just keeping that lens of both the public and personal health, and making sure that we isolate ourselves physically but not socially, because if we're going to get through this, we're going to get through it together.
Louise, if you, a senior citizen, and if you've been tested and you still haven't gotten the results after 10 days, what should you do?
Well, first of all, if you've gotten the test because, let's say, you have symptoms or you think you've been exposed, you should maintain your isolation, physical isolation, to make sure that you don't expose anyone else. But you should absolutely call about the test. We have seen that there's been delays with tests coming back. They used to take 48 hours, and now it is taking sometimes 7 to 10 days, depending on what lab they go to. But as you wait for your test, you maintain isolation so that no one else that you love or care about is affected by this. But yes, we have seen that some tests have taken up to 10 days.
So let me just say that in addition, and thank you so much, Louise, let me say that in addition to the information that she provided, please go to my website, bass.house, HOUSE.gov, GOV/coronavirus. We're trying to keep the website as updated as possible. So let me just say a couple of things, and then I want to take a poll question and go to the councilman to answer some of the questions that are in the queue. So the bill that we passed a little over a week ago was the third stimulus bill. We know that that is not all we need to do. We are now preparing for the fourth bill that will probably be put together and voted on by the end of this month. Whenever you have a crisis like this, you kind of run to stick your finger in the dam before the dam breaks, but you're not able to do things in a very thoughtful way, one, because we have never experienced anything like this at all, and two, because of the urgency, we had to act extremely fast. But now that we have just a few weeks and we have a lot that has already been done, it's time to find out, number one, did what we do help? Did people actually get their checks? Are they able to get on unemployment? Are they able to get an SBA loan? And if not, what are some of the problems? But we need to identify gaps, things that we did not cover in the bill that will need to be covered in the next bill. So keep that in mind. Also, we are going to have a specific call addressing the SBA, the Small Business Administration, and we also are going to have a separate call talking about some of the scams that are happening. So, for example, if anybody calls you to say, we can help get you the $1,200 check, you just need to give us, $10, $20, or $50, know that that is a scam. No one from the government is going to call you about the $1,200 check. The $1,200 check will automatically come to you, and no one should be calling you, frankly, about any of these resources. It's just not appropriate. Can we take a poll question, and then we'll go to the councilman?
You bet. Congressmember Bass, the first question goes like this. How would you like to receive updates from our office about the coronavirus going forward? There's 4 possible answers, so listen to them all before voting. Press 1 if it's postal mail. Press 2 if it's email messages. Press 3 if it's text messages. Or press 4 if it's voicemail broadcasting. Question again. How would you like to receive updates from our office about the coronavirus going forward? Press 1 for the mail. Press 2 for emails. Press 3 for text. Press 4 for voicemail. We appreciate you voting. Congressmember, back to you, please.
So let me take a few of the questions until the councilman jumps on. There is a woman who is asking about she's a driver and is having trouble getting unemployment benefits. Is there a solution that is being worked on for gig and freelance workers? Yes, there is. She should be eligible for unemployment, and if John would like to jump on and provide an additional information, that will be fine as well. But you should know that we are looking at the gig economy, and someone else asked about the entertainment community. We are looking at both of those. The entertainment community hopefully will be addressed in the next bill. You should know that Congressman Adam Schiff has specific legislation in addition to what we're doing to make sure that people in the entertainment industry are not left out.
Yes, this is John Alvarez. Yes, we are having people file for unemployment, your Uber drivers, people that are 1099s. Please do go to UI Online and apply. There will be a question in there asking if it was through a natural disaster. Please answer it. Put public health. We've been having people write in a little box saying that they're limited in their the Uber drivers are having no one to pick up lately. So, yes, people are applying. We haven't seen how it's going to come around for people that are on 1099s, but we are having them apply.
Wonderful. Let me go to the councilman now.
Hi, Congresswoman. So a couple questions we've got in front of us. One, is there transportation available for seniors? There are a couple things. One, MTA continues to run regularly, so folks should know that. So if you had access or any of those services, you should still be able to access those. There's also a service called Butterfly, which is like Uber or Lyft, but it's specifically for seniors, and they guarantee pickup within an hour. That's Butterfly with an I at the end instead of a Y, and the number is 855-267-2354. Another question that we got was around services for former foster youth or students who may be homeless now, can't shower at the gyms or buy supplies. I would encourage anybody who's a former foster care case who's under the age of 26 to apply with LASA and to make sure that they've connected with the county Department of Children and Family Services. The foster care and transition age youth is one category of homeless folks for whom there are resources. It's just a matter of connecting those resources. So not only should they be able to get into a shelter right away, and when I say right away, within hours of contacting those social workers, but they should be able to get permanent housing relatively quickly. So again, LASA is the LA Homelessness Services Authority, and then obviously LA County Department of Children and Family Services.
Thank you very much, Councilman. There is a question about that I would like to send to Claudia Monterosa about a landowner. It's nice that the tenant gets a break, but what about the landowner that is a small, maybe just owns one property or two properties? Is there any resources for them? Claudia?
Sorry, I was on mute. Yes. We are looking into resources for landlords, and there currently is in the state of California by Governor Newsom's order relief for residential mortgages. There is also relief at the federal level for Freddie Mac and Fannie Mae backed mortgages for both multifamily units that have a federally backed mortgage with the federal government, and those will be a forbearance that would not have any fees associated to it or any interest for a period of up to 60 to 90 days. We in the department are trying to understand all of the different resources that are coming as part of the CARES Act. We understand the strain on the small mom and pop and landlords that are offering a rental unit to tenants. And we are also engaged with the local apartment association and also with the California Apartment Association. And they are actually recommending their members to not to raise the rents and to work with the tenants to work out a repayment plan. And as I mentioned before, we as a city will be working on a rental relief program, and the way that will most likely work is that there will be a direct payment to that landlord on behalf of that tenant to pay the rent that is owed. We have to still figure out the details of that, but I would say that there is relief coming up, and we are going to continuously look to work with both the federal government, with the county, as well as with the state, and of course the leadership of the council, city council, and mayor's office to ensure that we are addressing the needs on both sides of the coin. It's not just the tenants, but it's also the providers for housing.
And let me just say that we recognize on a federal level that we did not do enough in this last bill. We are fortunate to have our own Congresswoman Maxine Waters, who chairs the Financial Services Committee that addresses housing. And through her leadership, she certainly recognizes that what we have done is not enough. If you have a Fannie or a Freddie, some assistance. If you don't, then you're out of luck. So we definitely hope that we will be able to address that in the future. Our healthcare worker wants to know how we can enforce people to wear masks when they go into a store. I think it's going to be more the social pressure, because you can't really enforce folks. I mean, I don't know if a police officer is around, maybe they would say something, but for heaven's sakes, we certainly don't want to go to that. What is being done to ensure everyone can vote safely by mail in November? You know, I don't think that there's going to be anything necessarily done different. I'm sure by November we'll have mail-in vote, but we will also have voting in person as well. One thing about this journey we're on, though, we have no idea what will be happening in November, and I'm certainly hoping we are past this. But I don't know in L.A. County that we would go to 100% mail-in. Some counties in California do that, but I can't see that happening here in L.A. County. For the senior who collects SSI, your $1,200 check, you will receive it in the same way that you receive your SSI. I also mentioned that we will be doing a call around the Small Business Association. We know that there's a lot of challenges with that, and hopefully we will be able to work out the kinks. Unfortunately, if you watch the president's press conferences, I think most people on the line know that the information that comes from the president is extremely unreliable, because he has said that $9 billion in loans were given out, and we don't have any evidence of a lot of the things that he says. So nothing new about that. We just know to beware what the president says. In terms of student loans are not forgiven. Student loans, there can be a deferment in terms of payment and also interest. Again, it's something we're working on, and I absolutely hope that we can do student loan forgiveness. I know Gary Silberger is worried about the immigration detention centers holding non-citizens. I am also absolutely concerned about that, especially the ones that are holding children. But you should know, too, that we're trying to make an effort for people to be released also from prison and jails. If you're in jail right now because you couldn't afford bail or because you have a traffic ticket, you should be released. If you're a pregnant woman who is incarcerated, you should be released. The people in the detention centers absolutely should. It is obvious what is going to happen to people who are in confined quarters where they cannot have social distancing. They have a lack of access to hygiene, and they certainly don't have masks. So they are all just sitting ducks, and we think that should absolutely change. Would you like to do another poll question, Kirk?
And, Congressmember, the second poll goes like this. What is your top priority for more information right now? 4 possible answers. Press 1 if it's small business and nonprofit resources. Press 2 if it's unemployment tax benefits and other individual benefits. Or press 3, housing resources like eviction and foreclosure prevention. Or press 4, healthcare testing and how to stay safe. Again, the question, so go ahead and vote now. I'll ask it again. What is your top priority for more information right now? Press 1 for small business and nonprofit resources, or press 2, unemployment tax benefits, and other individual benefits, or press 3, housing resources like eviction and foreclosure prevention, or press 4, healthcare testing and how to stay safe. Thank you so much for voting. Congressmember, take it back, please.
A person has asked about the states that are reducing resources and treating people who are healthier. You know, unfortunately, we do have a handful of governors that when this time period is over, in my opinion, will have blood on their hands because people are just going to continue to get sick. I'm sure you saw the governor of Georgia lifted the restriction that a county was attempting to do and basically have told people to go back to parks. Louise, I'd like to throw a couple of questions your way. Someone wants to know why can't they get the WHO test kits, and will there be an antibody testing available to see if we've already had the virus? Also, an individual that has arthritis and their medication is the one that Trump said could work for COVID, but now there's none on the shelves to treat her arthritis. To the person that was asking about WHO, I am a co-sponsor of Medicare for All. Louise?
Yeah, thank you for that. And just note, I am not a clinician, and so I'm not authorized to give any medical advice on this call, but I represent a whole bunch of them, over 800 providers in LA. So as far as the test kits go, I think, again, it's all about supply chain and where we sit relative to the channels of distribution. So that's the big piece about it. We've found, and so there's a number of different test kits, and I can't even keep track of the different types of tests that I've heard about to date. Our city, for example, is working with Welligent, I think it's called, and bringing in those tests. So those are coming, but again, they're going to be prioritized to the folks who are most likely in high-risk categories and who have been exposed or are showing the symptoms. And again, the antibody test, similar. It's a question of supply and demand and when we get it down. So I think this is all, and I'm not a scientist, so I'll leave it at that. Now on the arthritis meds, this is absolutely galling. I have a friend who has lupus, and her medication is also, that people have made a run on it, and so she can't get refills either. And so I absolutely understand, or I can empathize with what it is that you're going through as far as your medications. If you can contact your provider, if there's any help your provider can do in finding the medications for you, perhaps they've got samples at their clinic or anything like that. But just going to the pharmacy and being told, no, we're out of stock, that shouldn't happen to anyone. And I would say go back to your provider and ask them for help in helping you locate those medications. And it's really unfortunate.
And let me just say that I was just listening to the president's press conference about an hour ago, and he's touting the potential cure of this medication combination, and I don't think he understands that that's not the way it works. We do not have a cure for this right now. I also saw that on Laura Ingram's show on Fox, that there is a cure. She had someone on who said he was cured. I just think it's despicable to put out false information. So he either doesn't understand that that's not the way you run tests, medications through approval. Frankly, if I heard about a vaccine tomorrow, I'd run the other way, because vaccines and medications have to be tested to make sure that they don't have any negative impacts. So I would just be careful if you don't hear it from Fauci and some of the other scientists that there is a cure. Please do not believe it. There is a young woman who has not had income for 3 years because she was a student, and now she's diagnosed with cancer. Louise, you might make a recommendation of where she might go. I know St. John's Clinic has a robust center where they can help with social workers, but Louise, it might be one of your community clinics that you could call.
Absolutely, and I know a number of them are on the call, so I want to give a shout out to my friends from Watts Healthcare Corporation and others. But the best thing to do, and just especially given geography and the Congressmember's district is large, would be to go to 211la.org, put in your zip code, and say Community Health Center. And it will give you a listing, and you can look at the distance from you to them. There's a whole host. I mean, Congressman Bass has a district that has got a ton of really highly skilled, very qualified health centers that specialize in HIV, in behavioral health, in substance use treatment, in any numbers of resources and services. The challenge, and I didn't hear, Congresswoman, if you mentioned what her coverage is when it came to her condition.
I don't believe she had any.
Okay.
So had any coverage.
Okay, and so the health centers can help you get covered. That's, I think, the thing that really is where to start, is to give them a call, and again, start with the call, not the in-person, and say, I need to get access to coverage. And they have enrollment counselors there on site who can help you over the phone and direct you. I'll say also that Governor Newsom, our state has acted really quickly to extend open enrollment for Covered California, as well as ease enrollment and renewals in our Medi-Cal program. So it should be less difficult for you to get access to health insurance than prior to this emergency.
So we're going to take a couple of more questions, and then our hour will be up. But you should know that we're going to be doing these calls pretty regularly so that we can all get through this crisis. John, I would like to ask you to respond to Ronald Johnson, who was saying that his wife received her last employment check in December. Then she was laid off and cannot file until March 30th. Does she qualify under the current package?
Right now, if she received her maximum amount for the calendar year, she probably might not be able to apply again till her whole year is up. We haven't heard nothing that people in that situation could apply again. Hopefully we might hear something different.
So the stimulus amount, Elena Aragon is asking about the stimulus amount. $1,200 is an advance of the 2021 refund. This is not an advance. This is in addition. So the $1,200 that you should receive if you make under $75,000, this will not be deducted from your future taxes. This is not an advance. This is a stimulus check that is meant for you to pump it back into the economy. One individual is asking about the disproportionate impact of COVID-19 in the African-American community. We actually are going to begin, another hat that I wear is chairing the Congressional Black Caucus, and there have been a series of articles reporting this. But, you know, the Center for Disease Control, for whatever reason, decided to stop tracking racial data. And so we are going to make sure that they track this in the next bill that we do. You should know that the Trump administration has also taken advantage of this crisis to feed any affirmative action programs, and very few of them exist. but he decided to waive them, so businesses will not be held accountable. Also, he decided to waive environmental standards for programs and projects as well. I want to take a couple of more and then bring us to a conclusion, and let me make an absolute commitment that we will do a call very soon, specifically looking at the a Small Business Administration loan. And then for the free tax service, could I ask Nuria Samimi if you could please give that address, the web address for the service again?
Yes, sure. For the VITA site locator, that they can go either to franchise tax or website at www.ftbfranktombob.ca.gov and search for the word VITA, and then it would give them the link to locate a site near them. And either that or at the IRS site, the same way. Search for VITA and then search for the site close to them by typing in their zip code.
To give the results of the poll questions, people answered for the first one, how would you like to receive updates from our office about COVID? The majority of the people said email and text messages, so we will make sure that happens. The second question is, what is your top priority for more information right now? And health testing and how to be safe is number one. Unemployment tax benefits and other individual benefits is number two. And small business and nonprofit resources is number three. I'm surprised that number four is eviction and foreclosure prevention. So let me just say to everyone on the line, please be safe. Please do whatever you can to protect yourself. You know that our mayor has said that we should not leave home without a mask, and I hope that everybody is able to comply with that. We are going through just the most challenging time that I have ever experienced in my lifetime, where we have a public health crisis and an economic crisis at the same time. I believe that the impact of this virus we are going to feel for a very, very long time. We need to stay together, and I need your help in letting my office know what is working and what is not working. You can call my office at 323-965-1422. You can go to bass.house.gov. Thank you very much. We had 11,000 people on the line. I want to thank you for taking the time to be with us, and we will talk to you soon.